What are probiotics?
To put it into context, I'm going to give you actually two concepts to take home: probiotics and prebiotics. So first, because the question is what are probiotics, I'll focus on those. Probiotics are live microorganisms, typically bacteria, although there are some probiotics that contain yeast. But the majority of the probiotics, at least those that have been used in clinical studies, those that there's good evidence for their use and their safety, are compounds that contain live microorganisms, usually bacteria, that when ingested by a child, teenager, and adult, confer health or a benefit to that host. So an example would be somebody who had acute diarrhea due to some type of viral agent, and they took a probiotic, and I'll give you an example, something like Culturel. An active ingredient is a bacteria called Lactobacillus rhamnosus, and you take that for 7 days, 14 days, and there have been studies that have actually showed that the course of diarrhea, the severity of the diarrhea, number of stools, for example, that you have per day can be shortened. So probiotics are live microorganisms that when a person ingests them, confer health benefit. And in fact, the FDA had a meeting now some 20, 25 years ago, and there's a white paper about this, that two specific types of bacteria, lactobacillus and bifidobacter, actually got given GRAS, generally recognized as SAFE is the acronym, status for human consumption from birth through the elderly. Now, prebiotics are certain non-digestible compounds, usually complex carbohydrates, that actually are metabolized or broken down, ate, if you will, by the normal flora that are in the gastrointestinal tract, and promote the growth of good species, good bacteria. So bacteria such as lactobacillus and bifidobacter, which are normally living in our large and small intestine, predominantly the large intestine, the prebiotics type of compounds that you can consume, and then their growth gets augmented or enhanced, and then they push out the sort of less good or not so good bacteria. So prebiotics are really foods that you can eat that actually promote the growth of good bacteria. And there's a lot of exciting new research looking at combining pre and probiotics to see if that can actually have an enhanced benefit to the person. So I hope that answers your question.